Welcome to the deep dive. Oral health. It's just so fundamental, isn't it?
Absolutely. We often don't think about it until something hurts.
Exactly. And oral diseases can be genuinely debilitating. Plus, there's this constant search globally for new ways to fight those microbes.
Especially safe, cost-effective ways. And with drug-resistant bugs on the rise, that search is more urgent than ever.
Which brings us to today's topic, and it's a bit of a sweet surprise, actually. Licorice.
Not the candy, though, right? We're talking the herb.
Precisely. The ancient herb Yashtamadu, sweetwood, mulhati, used for literally thousands of years in traditional medicine.
A long history.
Yeah. So our mission today is to dive into how this really potent herbal remedy, which is packed with beneficial plant compounds.
Secondary metabolites.
Right. How it holds potential for preventing and treating, well, a whole range of oral diseases. We've looked at recent reviews, trials, lab studies.
Lots of data to sift through.
We've pulled out the key stuff, the important nuggets, to help you understand its, frankly, surprising dental benefits.
Sounds good. Where do we start?
Okay, let's get to know licorice itself. It's technically a sweet, moist, kind of soothing herb.
From the Glycerica species.
Yes, native to the Mediterranean, Asia, and used for, at least 4,000 years in Chinese medicine, Ayurveda?
That's right, a really long track record. And those names, Yashtimadu, Mohati, they really speak to that history.
And the sweetness is incredible. It comes from glycyrrhizin.
Glycyrrhizin, yeah. Apparently 50 times sweeter than sugar. It's quite something.
Nature's super sweetener, but with medicinal clout.
It is. And interestingly, the FDA lists it as generally recognized as safe, GRES.
As a food ingredient. Okay.
Right. But, and this is important, this raises the question, if it's safe, are there any downsides, any cautions?
Always the catch with powerful stuff.
Exactly. Excessive amounts can cause real problems. We're talking low potassium levels, hypokalemia, hypertension, muscle issues, even kidney failure.
Wow. Okay, so moderation is key. Are there specific limits?
There are guidelines. For medicinal use, some researchers suggest maybe 250 to 500 milligrams, up to 3 times a day.
Okay.
But the WHO is more conservative, suggesting 100 milligrams a day is safe. The Dutch limit it to 200 milligrams daily. And one study even found that just 100, 200 milligrams a day caused issues like hypokalemia or edema in half the subjects upon withdrawal.
So even seemingly small amounts need caution.
Definitely. And one more thing, people on anti-clotting meds need to be careful. Licorice has anticoagulant properties, so it could increase bleeding risk.
Right, good to know. So not a more is better situation at all.
Not at all.
But putting those important caveats aside for a moment, its general properties are pretty impressive, right? Antiviral, anti-inflammatory.
Antioxidant, anti-ulcerative, even anti-carcinogenic potential. It's a broad spectrum.
Which really sets the stage for all these different dental applications we're going to talk about.
It absolutely does. Those broad properties are what make it so interesting for oral health.
Okay, so let's dive into one of the biggest dental battles. Cavities, or dental caries. We all know Streptococcus mutans, right?
The main bacterial culprit, yes. Creates acid, builds those sticky biofilms.
Those horrible layers that just cling to teeth.
Yeah.
So how does licorice fight back?
Well, this is where it gets really interesting. Specific compounds in licorice, like glycerosol A and B, glyceric acid.
Okay.
They directly target S mutants. They basically stop the bacteria from multiplying and, crucially, stop them producing that damaging acid.
So it hits them on 2 fronts.
Exactly. And check this out. There's been research on sugar-free licorice lollipops.
Lollipops, seriously.
Seriously. Containing glycerosol A, one study found having these lollipops twice a day for just 10 days
Yeah.
led to a significant drop in S mutants in saliva. And that effect lasted for up to 22 days after they stopped eating the lollipops.
Wow, that's a lasting effect from just 10 days.
It's pretty remarkable. And similar findings were seen in other studies, with preschoolers, even nursing home residents.
So it works across different age groups. Seems like it. And beyond lollipops, researchers are isolating other compounds. Flavonoids like 1-methoxyphysophylenol.
Okay, don't test me on spelling that one.
Yeah. But things like licoriciflavin A, 6-phenyl-8-diprenylgenistein, they see potential for these in mouthwashes, toothpastes.
Future oral hygiene products.
Potentially. The core idea is these compounds pack a punch against cavity bacteria with effects lasting weeks. A lollipop that prevents cavities. It's an intriguing thought.
Definitely. But you'd still need more trials, I guess.
Oh, absolutely. More randomized clinical trials are definitely needed to confirm all this for mainstream use.
Still, imagine that, a tasty way to fight decay. That lasting effect is really something. Okay, let's shift gears. What about oral thrush or candidiasis?
Right, that fungal infection, Candida albicans, it's often opportunistic, causing trouble for people with weaker immune systems or on certain meds.
Yeah, it can be really uncomfortable. Does licorice help here too?
It shows real antifungal potential. Research indicates compounds like glycyrrhizin actually help bolster the body's own resistance to C. albicans, so it helps our defenses.
Seems so.
Uh-huh.
And even just a simple freshwater extract of the plant itself, Glycyrrhiza glabra, showed direct antifungal effects.
Interesting.
But what's really fascinating is a compound called glabridin. It seems to have this ability to modify drug resistance, meaning it can help make drug-resistant strains of C. albicans more vulnerable to standard antifungal drugs again.
Whoa, that's huge given resistance issues.
It really is. And other compounds like licochalcin A and glabridin again, they're good at stopping biofilm formation.
Those sticky layers again?
Yep, Candida makes them too. And they also help prevent the fungus from changing into its more invasive form, the high-full form.
That sounds important.
Very. Plus, they can work with conventional drugs, like nystatin, making them more effective together. A synergistic effect.
That's incredibly useful. Finding natural compounds that either fight directly or boost existing treatments, that seems vital today.
It really does. A natural alternative or a helper.
Okay, let's tackle gum disease now.
For sure.
Affects so many people. Gingivitis first, the gum inflammation.
Right, inflammation confined to the gums.
And then periodontitis, which is much more serious, destroying the tissues and bone holding teeth in place.
And a key bacterium there is Porphyromonas gingivalis, or P. gingivalis.
So how does licorice step into this fight?
Well, for gingivitis, certain water-based extracts from licorice show strong anti-adhesive effects. They literally stop P. gingivalis from sticking to the gums.
Stops it getting a foothold.
Exactly. And other compounds, licoricidin and licoricoflavin A, they inhibit the bacteria's growth, but also reduce those smelly, volatile sulfur compounds.
Ah, bad breath control too.
Potentially, yes. And they decrease the activity of tissue-damaging enzymes called proteases.
Okay, so that's tackling the bacteria and some symptoms. What about the deeper problem, periodontitis?
Right. Connecting this to the bigger picture, licorice isn't just fighting bacteria, it's calming the body's own inflammatory response. That's crucial in periodontitis.
How does it do that?
Licorice extracts can inhibit pro-inflammatory signals, things like IL-1 beta, TNF-alpha, chemical messengers that basically fuel the fire of inflammation in the gums.
So it dials down the inflammation.
Precisely. And those compounds, licoricidin and licoricoflavin A, they also inhibit enzymes called MMPs, matrix metalloproteinases.
MMPs? What do they do?
They break down tissue. They're major contributors to the destruction you see in periodontitis. One study actually compared licorice extract to low-dose doxycycline, an antibiotic.
Yeah.
And found licorice was promising in reducing levels of MMP8, one of those key destructive enzymes.
That's impressive, a multi-pronged attack bacteria, inflammation, tissue damage.
It is, but it goes even further, potentially helping with bone health too.
Really? How so?
This is quite remarkable. It seemed to have potential to prevent the bone loss that happens in severe periodontitis.
Wow.
Specific compounds like 18-glycerinic acid and isolecrodinogen were shown in animal studies in mice to prevent inflammatory bone loss. They inhibited osteoclasts.
Osteoclasts. Those are the cells that break down bone, right?
Exactly. And another compound, glabridin, seems to stop new osteoclasts from even forming a process called osteoclastogenesis.
So it's protecting the bone structure itself.
That's the potential, yes. So stepping back, licorice offers this really comprehensive strategy for gum health. It's not just antibacterial, it's anti-inflammatory and potentially bone-preserving.
That's fascinating, a truly holistic approach from one herb. Okay, let's talk about something else, common and painful canker sores.
Ah, yes. Recurrent aphthous ulcers. They can be miserable.
Totally. Makes eating, talking just awful. You said licorice might be a game changer here.
It seems so.
Yeah.
Several studies point to it reducing the pain, how long the ulcers last, and even their size.
That sounds promising.
Yeah, there was research on things like over-the-counter patches, Canker Melts GX, and also dissolving oral patches with licorice extract. Both showed significant improvements.
Patches directly on the sore.
Exactly. And another study looked at a bioadhesive hydrogel patch. Basically, a patch that sticks well inside the mouth made with licorice.
Yeah.
It was effective not just for pain, but also reduced the redness, the inflammatory halo around the ulcer, and the necrotic center, the dead tissue bit.
Wow, that's quite specific relief.
It is. The practical takeaway is pretty clear. For people plagued by these things, licorice applications could offer real, fairly rapid relief.
That's brilliant news for sufferers. A natural option for such a common, nasty problem is very appealing. Okay, now for a much more serious topic. Oral cancer.
Yes, specifically oral squamous cell carcinoma, the most common type.
Does licorice show any potential here? It seems almost too good to be true.
Well, the research is compelling, showing what's called chemotherapeutic potential. A flavonoid from licorice, isolicoridojanin, or ISL.
ISL, got it.
It acts as an inhibitor of tumor angiogenesis.
Angiogenesis, that's blood vessel growth, right? For the tumor.
Exactly. Tumors need new blood vessels to grow and spread. ISL seems to help cut off that supply line. It also just shows general anti-cancer effects.
Okay. Any other compounds?
Yes, look at chalcodon A. This one seems to induce apoptosis that's programmed cell death in oral cancer cells, basically telling the cancer cells to self-destruct.
Powerful stuff.
And it also significantly inhibits the cancer cell's ability to move and invade nearby tissues, which is critical for stopping metastasis or spread.
So it hits cancer growth, survival, and spread.
That's what the research suggests. And there's more, a water-soluble compound from a different licorice species, Glycyrrhiza inflata, also showed it could kill oral cancer cells via apoptosis.
Amazing range.
And on a related note, for patients actually undergoing chemotherapy, a traditional preparation called Yashtamadu grita, basically licorice processed in ghee, showed promise in reducing mucositis, those really painful mouth sores caused by chemo.
That would be a huge relief for patients.
Absolutely.
Yeah.
So yes, licorice is showing remarkable promise in the complex fight against cancer. Key compounds seem to target cancer cells directly, even cutting off blood supply.
But more research needed, I assume?
Critically needed, yes. But it definitely opens exciting possibilities for new therapeutic approaches down the line.
Incredible potential. Okay,
Yeah.
one last area, root canal therapy.
Right. A big challenge there, especially in treatments that fail, is a bacterium called Enterococcus faecalis.
Why is that one such a problem?
It's just really tough. Often resistant to the standard cleaning solutions used in root canals, like sodium hypochlorite or chlorhexidine.
So the standard stuff doesn't always kill it.
Not always, no. And this is where licorice might offer an alternative. Lab studies, in vitro studies, have shown that licorice extract significantly inhibits E. faecalis, both when used on its own and when combined with calcium hydroxide, another common root canal medicament.
So it works against this tough bug.
It seems to,
Yeah.
but what's perhaps even more striking from that research?
What's that?
The study noted that the licorice extract, whether used alone or in combination, was much gentler on the surrounding healthy cells.
How so?
It preserved significantly more viable periodontal ligament cells. Those are crucial cells that support the tooth compared to using calcium hydroxide alone, which can actually be quite toxic to those cells.
Ah, so it kills the bad guys but spares the good guys, relatively speaking.
That's the really interesting insight, yes. It's not just antibacterial against a notorious bug, but potentially much safer for the tooth's own tissues.
That sounds like a major potential benefit, a safer, effective herbal option for root canals.
Exactly, a promising alternative.
So let's try and wrap this up. We've taken quite the deep dive into licorice today.
We certainly have.
And uncovered this, well, incredible world of potential for oral health. It's anti-inflammatory, anti-adhesive, antimicrobial powers.
Really diverse benefits across so many areas.
Yeah, from cavities, gum disease, those painful ulcers, even showing promise against oral cancer and helping with root canals. It's quite the resume.
It really is. But, and it's a consistent theme in the research we looked at.
More studies needed.
Absolutely. While the findings are definitely promising, the sources all stress the need for more in-depth studies, specifically more in vivo work in living organisms and those large-scale randomized clinical trials.
Right, the gold standard.
Those are really the essential next steps to fully understand how to best use licorice and its active compounds in everyday dental products and clinical practice.
Which really leaves us with a fascinating thought, doesn't it? This raises an important question. As we look ahead, how might integrating these ancient herbal remedies, once they're rigorously validated by science, how might that transform our whole approach to taking care of our mouths? Could it make oral care, well, more accessible, more natural, maybe even, given our topic today, a little bit sweeter?